Aspirants of European Diploma in Intensive Care. Here I am Dr. Sunil Garg to guide you in the journey. In this video, we will go through several questions spanning different organ systems. I will read the questions for you. If you still need more time to understand questions, you can pause the video to read question yourself. You can take your own time to practice and understand. Subsequent to the question, you will find the correct answer for that question and its explanation. For questions number 11, there will not be any answer and explanation available. This is a new feature of my video and this question is designed in a different manner and unique way. You can write its answer and explanation in the comment section box to have a wonderful discussion. For any more explanation, please write down in the comment section so I can respond there. I wish you a great journey ahead. The primary aim of initiating this is to introduce you to a variety of questions the way it appears in exam with different organ systems. Questions are based on basic knowledge and concepts and easy to understand, and their difficulty level is moderate. These questions are designed to test knowledge and understanding of critical care. The explanation provides the rationale behind the correct answer, helping to reinforce learning and understanding of key concepts in critical care medicine. Now you can see questions and their choices. Question number 1. A 60-year-old female with a history of deep venous thrombosis in the setting of malignancy presents with recurrent DVT despite being on therapeutic anticoagulation with warfarin. Her INR is within the therapeutic range. What is the most appropriate next step? Choice A. Increase the dose of warfarin. Choice B. Switch to low molecular weight heparin. Choice C. Add aspirin to warfarin therapy. Choice D. Perform thrombophilia screening. And choice E. Initiate dual anticoagulant therapy. Here is the correct answer for question number 1. Answer B. Switch to low molecular weight heparin. Here is explanation. You can read explanation yourself. Question number 2. A 48-year-old female with non-systemic lupus erythematosus presents with acute shortness of breath and pleuritic chest pain. Her D-dimer is elevated and a CT pulmonary angiogram shows bilateral pulmonary emboli. Which of the following is the most appropriate initial anticoagulant therapy in this patient? Choice A. Low molecular weight heparin. Choice B. Unfractionated heparin. Choice C. Rivaroxaban. Choice D. Warfarin. And choice E. Thrombolytic therapy. Here is answer. Answer A. Low molecular weight heparin. Here is an explanation. Please read the explanation yourself. Question number 3. A 68-year-old male with a history of coronary artery disease and heart failure presents with confusion, lethargy and decreased urine output. Laboratory test reveal serum sodium of 115 millicoulant per liter, potassium of 3.8 millicoulant per liter, serum osmolality of 250 milliosmol per kg and urine osmolality of 550 milliosmol per kg. What is the most likely diagnosis? Choose the best answer. Choice A. This patient has syndrome of inappropriate antidiuretic hormone SIADH. Choice B. This patient has cerebral salt wasting syndrome because of altered mental status. Choice C. This patient has diuretic thiazide induced hyponatremia in the setting of heart failure. Choice D. This patient has hypervolemic hyponatremia due to high plasma volume. And choice E. This patient has hypervolemic hyponatremia. Here is correct answer. Correct answer is E. This patient has hypervolemic hyponatremia. Here is an explanation. Please read explanation yourself. In the next slide, you will find a chart where you can see how a heart failure patient develops hyponatremia. Question number 4. A 50-year-old female with a non-Addison disease presents with vomiting, fever, abdominal pain and hypotension. Her serum sodium is 128 millicoulomb per liter, potassium is 6.2 millicoulomb per liter and glucose is 50 milligram per deciliter. Which of the following is the most appropriate immediate treatment? Choose best answer. Choice A, intravenous hydrocortisone and fluid resuscitation. Choice B, intravenous insulin and glucose. Choice C, oral fludrocortisone and sodium supplementation. Choice D, intravenous calcium gluconate and bicarbonate. And choice E, intravenous hydrocortisone and intravenous antibiotic. Here you can find correct answer. Correct answer is choice A, intravenous hydrocortisone and fluid resuscitation. Here is an explanation of question number 4. Please read explanation yourself to understand it better. Question number 5. A 60-year-old female with a history of ischemic stroke presents with acute left-sided weakness and a gaze preference to right. Her initial CT scan showed no hemorrhage. She is administered intravenous thrombolysis within 4 hours of symptoms onset. 12 hours later, she becomes obtunded and repeat imaging reveals a large hemispheric infarction with midline shift. What is the most appropriate next step? Choice A, administration of hypertonic saline. Choice B, emergency decompressive craniotomy. Choice C, repeat intravenous thrombolysis. Choice D, initiation of therapeutic hypothermia and heparin infusion. And choice E, administration of mannitol and hypercapnia. Here is a correct answer. Correct answer is choice B, emergency decompressive craniotomy. Here is an explanation. Please read explanation yourself to understand it better. Question number 6. A 45-year-old male with a history of hypertension and diabetes presents with acute shortness of breath. He has a blood pressure of 90 by 60 mm of mercury, heart rate of 110 beats per minute, and oxygen saturation of 88% on room air. His ECG shows low voltage QRS complexes and a bedside echocardiogram reveals pericardial effusion with signs of right ventricular diastolic collapse. What is the next best step in management? Choice A, intravenous diuretic. Choice B, non-invasive positive pressure ventilation. Choice C, immediate pericardiocentesis. Choice D, high flow nasal oxygen. And choice E, intravenous fluids and vasopressor administration. Here is correct answer. Correct answer is choice C, immediate pericardiocentesis. Here is an explanation. Please read explanation yourself. Question number 7. A 58-year-old female is undergoing mechanical ventilation in the ICU following a cardiac arrest. Her end-tidal CO2 levels are being monitored. The EtCO2 reading suddenly drops from 40 mm of mercury to 20 mm of mercury. Which of the following is the most likely cause of this change? Choice A, acute pulmonary embolism. Choice B, improvement in cardiac output. Choice C, improvement in ventilation perfusion mismatch. Choice D, ET tube dislodgement into esophagus. And choice E, pulseless electrical activity. Here you can find correct answer. Correct answer is choice A, acute pulmonary embolism. Here is an explanation. Please read explanation yourself. Question number 8. A 65-year-old male with a history of chronic heart failure is admitted to the ICU with worsening dyspnea and peripheral edema. Hemodynamic monitoring is performed and the following values are obtained. Central venous pressure 15 mm Hg, mean arterial pressure 65 mm of mercury, cardiac output 3.5 liter per minute, pulmonary capillary wedge pressure 25, systemic vascular resistance 1600 and heart rate 106 per minute. You start him on a medication as intravenous infusion and after 1 hour you notice central venous pressure 13 mm of mercury, mean arterial pressure 64 mm of mercury, cardiac output 4.2 liter per minute, pulmonary capillary wedge pressure 22 mm of mercury, systemic vascular resistance 1209 cm, heart rate 108 per minute. Which of the following medication was given to him? Choice A, dopamine. Choice B, dobutamine. Choice C, epinephrine. Choice D, norepinephrine. And choice E, nitroglycerin. The correct answer is choice B, dobutamine. Please read an explanation here. Question number 9. A 30-year-old female with a history of severe asthma is intubated and placed on mechanical ventilation with ongoing sedation and paralysis due to status asthmaticus. Despite appropriate sedation and bronchodilator therapy, her peak inspiratory pressure remains elevated, her end tidal CO2 is elevated, she develops further increase in peak pressure along with increase in plateau pressure and hypotension. Which of the following ventilator strategy is most appropriate to manage this patient? Choose most appropriate answer. Choice A, increase tidal volume to enhance ventilation. Choice B, increase respiratory rate to reduce CO2 retention. Choice C, decrease inspiratory time and increase expiratory time. Choice D, use higher levels of PEEP to counter auto PEEP. And choice E, increase expiratory time by reducing respiratory rate. The correct answer is choice E, increase expiratory time by reducing respiratory rate. This is an explanation for question number 9. Please read explanation yourself to understand it better. A 70-year-old male with septic shock secondary to pneumonia is admitted to intensive care unit. Despite aggressive fluid resuscitation, he remains oliguric with rising creatinine level. The decision is made to start continuous renal replacement therapy. Which of the following is the most compelling indication for initiating CRRT in this patient? Choice A, creatinine level of 4.5 mg per deciliter. Choice B, blood urea nitrogen of 100 mg per deciliter. Choice C, respiratory distress due to fluid overload unresponsive to diuretic. Choice D, hyperkalemia with serum potassium of 5.5 milliequivalent per liter. And choice E, metabolic acidosis with pH 7.3. Correct answer is choice C, respiratory distress due to fluid overload unresponsive to diuretic. Here you can read an explanation for this question. Please read it yourself. This is question number 11. You will not find any answer and explanation of this question here. Please write your answer and explanation in the comment section box to discuss it further. And please read this question yourself. Thanks for watching this video. Please do not forget to subscribe to this channel. See you in my next video on some interesting topic. Till then, bye and thanks.